नमस्ते, मैं डॉक्टर आरती शहाडे पुणे से बात कर रही हूँ. Yeah, today I'm going to talk to you about self-monitoring of blood glucose. That is, how do you do monitoring of at home and why you should do. See, any diabetic who is on medication or not on medication must know what the sugars are. You all know that the target sugars would be fasting between 90 to 100, and after meals it should not be exceeding 180, right? So many of our patients are only on diet and exercise. They do not take any medication for their sugars. But then it is likely that the sugars will shoot up. How will they know if it shoots up? So it is better that they keep doing sugars, especially after a meal, so that they know how the meal has affected the sugars. It is important because many people will respond differently. So don't compare yourself with others and say that by eating, a one bowl of rice, my sugar will increase by only 30 milligrams. No, it's not like that, right? And if someone else's is increased by 30, it doesn't mean that in you also it will increase only by 30 milligrams. So it is important for you to know what the sugar levels are, and that will help you in compliance of exercise and diet. All right. But then you have another set of patients who are on medications, that is tablets, not on insulin. Do they require glucose monitoring at home? Of course, yes, they do require. Why? That is because, again, the meals keep changing, the timings keep changing. And if they have a very tight control, if their HbA1c is say 6.5 or 7, around that, if they delay their meal or if they don't eat in time or their required quantity is little different from the usual, they're likely to slip into hypoglycemias, that is low sugar levels. Similarly, when they eat a big meal, if they indulge, then it's likely that the sugars will go up, right? They will go beyond the normal. So they also must know what is happening to them and whether the medicines that they are taking are actually helpful or not. Suppose I take the medicine, eat food, and do PP blood sugar, and the PP blood sugar is consistently 220. So that means the tablet that I'm taking is insufficient to control the post meal surges in the blood sugars. Correct? So I need to change my medication. I need to go to my doctor. It's as simple as that. And then you have patients with on insulin. They, of course, have to do sugars. If they're bored of doing sugars, they can use patches, which we use, that is continuous glucose monitoring systems. But otherwise, a glucometer should be fine. So then these patients also require to keep a very good tight control. In fact, we give insulin, especially in 2-DM, to maintain very good glucose control. If despite taking insulin, if the sugars are not under control, that means something is wrong. Either their diet is not right, or the insulin that we are giving is insufficient, or the timing may be wrong, or it may be that the technique may be wrong, right? So all this needs to be corrected. Just because you are taking insulin doesn't mean that the sugars will be normal all the time. No, that's not going to happen, right? And then, see, most of us tend to fall sick now and then, at least common cold or say diarrhea after you eat out, especially in rainy weather, right? So some indulgence might give you actually some kind of a problem, right? Not very unlikely. Yes. Or you may come down with fever, some infection. What happens then? Remember, with infections, the sugars go up even if you don't eat. All right. People think that just because they have not been able to eat and they've not eaten, the sugars are not going to rise. No, that's not going to happen. With infections, the sugar will rise even if you don't eat. Similarly, it's also likely that the sugars may go down because of the action of the previous drugs, right? Especially if you have not eaten. So both are likely to happen. So what do? We follow what is known as sick day rules. All right. So we need to take our sugars frequently. All right. treat ourselves well. Those on insulin, they might have to decrease insulin, not stop altogether, and have a little bit of calorie dense food. And if they're not able to uh, eat anything or drink anything, they need to go to the hospital because they should not get dehydrated. Because dehydration can bring in different set of complications altogether in type 2 diabetic patients. So remember, the self-monitoring of blood glucose, what we call as SMBG, with a glucometer is very important, right? So on this note, I close this today. Thank you for listening. You can log on to me again for another topic, which will be very useful for you for your management of sugars, BP, so on and so forth. Thank you very much.